Hi, everyone. Welcome to my podcast, Voices on the Journey. I am the host, Jarvis Lepper. Today we have John Grass, who operates the Grass Home, and we have Amy McNair, who operates the McNair Home. Both of these homes are operated in the Greater Moncton area. Welcome to the podcast.
Thank you.
Thanks, Jarvis. Nice to be here.
And you guys are both part of the Journey Church family, and I'm excited that you're here to share on this podcast. We've been
excited that you're excited, Jarvis.
Oh, I'm excited. We've been through a year like no other, and the question is, what will the post-pandemic world look like for senior care homes? What kind of reality will emerge? John, as senior care home leaders, what do you anticipate will be the new reality post-pandemic?
It's difficult to say, Jarvis, really. We'll love our seniors, we'll have visitors, we'll have, I think life will get back to mostly to normal, but we'll have to look at, where does this virus go next? We don't just have one virus out there. So we've had a UK variant and a Brazil variant and and an India variant. Is there another variant coming? And how long does the vaccine last? When will we need a booster? So those questions are unknowns, and I think that our public health is doing a great job. We're getting bulletins all the time from them as to trying to keep us up to date with the latest information. So right now, I think it's important that we get our vaccinations and we protect with the data that we have. That's the best thing that we can do today, and that'll get us back to some semblance of normalcy.
Amy, many of the seniors have been through the polio pandemic, and many received their polio vaccine in the 1950s. Do you find the seniors are open up to vaccines because of their experience with the polio vaccine?
First, I think it's important to define that fact that seniors is actually a pretty broad group of ages. So in our context, at McNair Home and Grass Home, we're serving people on average who are the age of 90, which true means they were born in the 20s and 30s generally. And then there's another group, they would be their children, who are coming up as seniors who were born in the 40s and 50s. My observation is among those seniors who are residents in long-term care, there is of course a memory of polio and other medical advancements over the years. We're talking about 100 years of medical advancements that they've witnessed, which is remarkable. So sure, that's part of what influences their uptake on the vaccine. But also they have a very deep respect for their physicians. There's almost a reverence towards them. At least that's what I recall when talking to my grandparents, for example, and it's what I hear when I'm in my buildings. There's a reverence for the advice of the physician. Also, they have a deep respect for the fact that they are living in a community that is bigger than a family and has a bigger impact, therefore, toward others if there's illness in the building. So there hasn't been any hesitancy among our residents. Now, to comment on their children, the baby boomers, I believe they're motivated to get their vaccines because they've done a risk assessment of their own, generally having health conditions that are chronic and lead them to some kind of frailty. If they get ill with COVID-19, they have uptake on the vaccine front. The younger generation is where I think you're seeing more hesitancy. And I haven't talked to enough of those people the last year to really know why.
I love that line, Amy, where you say that seniors have a respect for doctors. I know when I get sick next time, I don't want to take my diagnosis to Facebook for people to diagnose me. I want a professional to look at me, and that's a good point.
Yeah, there's a huge amount of trust, and it's you know they would come back from the doctor. The doctor said, so doctor said. There's just that respect and trust. I agree, Amy. It's huge with that group.
John, if 25% of the population do not get vaccinated, we're hoping that the majority of New Brunswickers will. How will this impact future visitations to senior care homes?
The major concern I have is when we can't get away from our masks. Amy talked about the community. Like in our home, it's a community. The residents all know each other, and they know the staff. And this is, we're an extended family. When we can't take our mask off, we're losing that social stimulus with our residents. They can't see us smile. They can see us wink, but just a wink isn't. But a smile and a wink, that probably looked a little funny. I should practice that in the mirror maybe, but but that social stimulus of seeing someone's face, and when someone smiles, it's part of our well-being. It's part of our motivation. It's part of who we are. It's food for the spirit even. And if we only get 75% vaccinated, and my concern is if we have to continue to wear masks amongst the vulnerable, which will be, daycares, seniors, that's going to be a challenge. And I hope that doesn't happen. I hope that we can relax to the point where, we've got that herd immunity. And because of that, there's some liberties we can take with masks, hoping that happens. I don't mind wearing it, in a grocery store, but in a senior's home, I'd really like to be no masks.
And if we continue with masks, maybe John and Amy, you could get a picture of yourself and put it right here on your shirt. Then people can see that you're smiling.
Yeah, actually, funny enough, during the pandemic is the first time we've ever worn name tags in our buildings.
Mm. Yeah, it's tough.
And I just, I guess to springboard off of John's remarks about masking, that is a consequence that is very likely if there is a reason a person has not gotten the vaccine. That is a very likely consequence to visiting our facilities. And the 6 feet of distance, of course, as well, because that is just simple math and science. Also, just about the soft things that we lost by having to distance and mask. I had an experience last week and I thought, yep, I made the right choice a year ago, having my dog go on a leave of absence from work. He comes with me to work every day, and the poor guy had to go on a leave of absence because of COVID-19. And here's why: because when the dog, or when a child, or when a friendly visitor is in the building, we break that 6-foot rule. We break it immediately. It's just human nature. And people ask questions about this novelty. So in the case of the dog, it doesn't matter how many times they've met him, they always ask questions about him. And because it's a new conversation, it's not routine, like, what do you want in your coffee is a routine question. It means they can't hear what I'm saying. Often these people are hard of hearing, and they're curious and may ask a novel question, want to have a new conversation, but they can't hear what I'm saying because my mouth is covered. And so what is a soft and beautiful and loving moment becomes a huge frustration when you're wearing a mask.
I can understand that. I know the senior care home in my hometown has cats. They find that those animals are therapeutic, good for their mental health. Have you had some experience with regular pets, or what's your
Yeah,
perspective on that?
absolutely. So there is a great chance that no one there knows my name, but they know Bailey's name. Okay, because we retain emotional memory very, very late in life or very late in dementia. And emotional memory is triggered when we have emotive experiences, positive or negative. So the pet does that for people with dementia, especially. So yeah, we do have house cats, and they haven't lost their jobs because they're part of the family.
They're not wearing masks.
And they're not wearing masks. They reside there.
John, do you have experience with animals in your home, or what's your
Yeah,
take on it?
yeah, we do. We have two golden retrievers, so they still come in, but when they go upstairs, they're on a leash, and we walk around, and Amy's right. You know, sometimes that 6-foot rule has to break, and but there's a huge benefit. You know, the smile and the spirit and the uplift that they get is amazing. We had this year we've had a couple of occasions where there's a company in town and they have alpacas and llamas. And our activity coordinator asked me, she said, so, you know, I've made contact with this group, and they'd like to come in. And I said, oh, okay. She said, well, they're house trained. I said, what do you mean, they're going to be in the house? She goes, yeah, no, they're house trained, but it's up to you, you know, with COVID, and we understand and all. And I said, well, but they're house trained. And I said, okay, well, they can come in the front door, and the residents can stay 6 feet apart, and they'll come in and they'll walk through and they'll go out into the courtyard, and then they'll go back in their trailer and they'll be gone. And I said, okay, I'm okay with that. And so that was the plan. And so these alpacas came in, and they're as friendly as it's amazing. And they come in, and the residents lit up with joy, and just the spirit that was there was amazing. And they hugged them, they talked to them, and so one of them was Pearl and Luna. Like Amy said, they remember their names, but what was your name again? Jeffrey, Jimmy, Jarvis, that's right.
There we go.
But Pearl and Luna, anyway, one of them was pregnant, and the residents know that they had babies, and in July they're coming back with their babies, and the residents, like, it's not on our calendar yet because we don't know the day, but the residents are looking forward to that. And so, you know, so pets touch an emotional part of us that you don't get anywhere else. You don't get it at the grocery store. You don't get driving a car. You know, you don't get from sunshine. Pets touch us in a way, and they always have. And we need to be cognizant of that when we're dealing with our seniors, as to, you know, what's important to them. You know, an excellent diet, exercise. You know, there's the balance in life. There's spiritual. You know, what do they need? And part of that is that stimulation. And it's you know, we're not meant to be isolated. We're not meant to wear a mask and not see people. You know, it's kind of counter to who we are as people. And when those are taken away, you know, we had a fight to get that back. And so I think pets are a great way to do that.
Absolutely. And speaking of mental health, animals are good for our mental health. And you know that we're all on a mental health journey. Amy, I heard about a senior that was moved to palliative care during this pandemic. And because she was in palliative care, the family could finally come in and visit with her. But that revived her soul, her mental health. And then she was moved out of palliative care. And then the family couldn't visit her. Then she was moved back to palliative care, back and forth. What resources are in place to help seniors' mental health during this pandemic time?
Yeah, that is I think a very common example. And I'm hopeful that in most of those situations over the last year and a half, administrators have been able to be thoughtful and assess the situation, you know, individually, apart from the blanket of rules that apply generally to our residents. And I hope that was that family's experience. But yeah, that's more evidence of how our body and our mind are connected and how relationships therefore affect our health. If a senior is in need of mental health intervention, we have in the Horizon Health Network and also the Vitalite Health Network geriatric clinics that specialize in meeting the needs of people generally over the age of 65 in a holistic way. I think one thing I really like about working in geriatrics is it is a holistic way of practicing healthcare. And so these clinics that can be accessed through your family physician will address issues related to depression, dementia, mobility changes, maybe there are frequent falls or weakness emerging. And also some of the challenges that family members might notice in the home setting where medications might not be taken correctly, hygiene or eating can become a problem. These geriatric clinics assess the whole person and address some of those concerns as best as we can. But I would encourage anyone noticing changes like that in a senior to prompt them to ask for help through their family physician, and not to give up, to ask frequently. A lot of family physicians will increase the frequency of appointments with people who have emerging needs like that, so that at the right time, the referral can be made to the specialist clinic through the geriatric program.
John, how about you? What resources come to your mind when it comes to mental health and seniors?
There's a lot out there, but it's relying on your primary physician is the best. But we just have to care more. I know that in life that we're busy, and everybody's problems. My problems to me are big problems to me. Your problems to you are big problems to you. If you had my problems, you'd go, they're not that big. They're not nowhere near as big as my problems. And we need to be more respectful to those people. And I look at our seniors in our home, and excuse me, is spend more time with them. Just sitting with them and being with them. And I look at some of the things that we've done. We've had on a couple of occasions, I mentioned the pet therapy, but we've had youth come in, and and that's we've had our seniors in tears. They're so happy to see the youth. And when you think about mental health therapy, there's not a prescription drug on the planet that can do some of the things that youth can do when they connect with seniors. So using technology, whether it's FaceTime or even having a window visit is great. It doesn't replace being in person and having no mask on. That's our reality. We have to accept reality, and we have to look at it and go, how do we make the best of our situation? And we've had residents. One of our ladies was 100 years old, and she had a birthday celebration with a window visit. And her family desperately wanted to be inside and hug her and all of that. But she made the best of it, and she had a wonderful birthday because because people cared, people spent time with her, and that's really what they want. They don't want to feel isolated and alone. They want to feel that someone cares. And when we reach out and spend time, I think it just pays huge dividends for them.
I was looking at senior care in China, and often as the parents get old, they live with the kids. So you get that consistent interaction. Do you think that we are quick to put seniors in senior care homes? I know there are some cases where they absolutely need to go, but in some cases, do you find that we try to push them out of our lives quickly for the home to look after?
Well, let's look at China, for instance, and that's a communism environment where it's a totally different way of life than we have in a capitalist market that we have, where a husband and a wife can both work, they in their jobs, they decide how many children they want, and they decide where they want to live. They don't have to have social merits that they have to accumulate. They can't live in this area because they don't have enough social credit to live there. And it's completely different. And one of the changes that we've had in our society is we've got in most cases we've got a 2-income family, and that's put stresses on the family unit far beyond just the mom and dad or the grandparents. It's put stresses on the family unit from the children all the way up through. I don't even know if China even has daycares. I don't know if they have that. But I look at here, our seniors have needs that can't always be met on their own, and they can't be met in the family unit. And I think we're doing the best that we can, and I don't really think there's another model. I know we moved when we had our young children. We moved closer to my mom and dad. So when my kids get off the bus, they get off at mom and dad's house, and mom had cookies for them. And when we were done our work day, we would stop and pick them up and have a coffee with mom and dad, and that was wonderful that we were able to do that, and we cherish those memories. But it's not everyone can do that. It's just, I think it's just a little more challenging with a 2-income family. I think that's changed our society, and materialism has been part of that. The need to be busy and busy and busy, I think, has changed that, and I think that's just part of what we have.
Amy, would you like to follow up with that? Are we quick to push people out, or do you see a value in the current system?
When I say the average age of our residents is 90, that's what I mean. They are moving in after the age of 90, and
Right.
and I feel like applauding them, because I highly doubt that'll be me. I will not be that healthy, and I will not likely have remained in my home for that reason, for that long. And I don't believe their children will have that same experience either, because the baby boomers, I think, are not going to age in the same way as this current group of long-term care residents is aging. No, in New Brunswick, I think people are generally old-fashioned to the degree that they do care for one another as long as possible. They remain independent for as long as possible, and they value that. But yeah, then there's just reality. I mean, long-term care is becoming very complex as a practice. Geriatrics is a very complicated kind of medicine. So no, we're not pushing people out early. They're leaving necessarily, and at the very last possible moment.
I know my grandmother was in her own home when she was in her 90s, and she would even go down in the basement and fill the furnace up with wood. And the doctor said, that's what's keeping you healthy. And then she had that fall where she needed help of a senior care home. And it's certainly important what you guys do.
Yeah, my grandmother was 84, and she still operated her special care home at 84, taking care of seniors.
That's amazing.
And then one other thing I'd like to bring up, Jarvis, is someone told me, they were in the healthcare business, and they told me that when Spencer first opened, Spencer Home on Salisbury Road, when they first opened, some of their residents drove their car there and moved in, like walked in with a suitcase. That was what, a new admission might have looked like, 50 years ago, 40 years ago. That's not, and like Amy says, that's not the case today. Then it was, well, that's where I'm going to go live, and that's great. Now it's people want to be home, they want to be independent, they grab onto that and they squeeze that as long as they can. And when they're coming into a long-term care setting, their care level is much more complex. and I think that's a great thing. I fully support that. But yeah, that's just how things have changed.
And John, speaking of change, our culture is radically changing, and because of this pandemic, there's even more change. Moving forward, how can senior care home leaders stay on top of constant change?
With regards to the pandemic, we rely heavily on social development and public health. We rely on the news, and we're voracious appetite for what is happening, where are we going with the pandemic. I think technology is going to play a huge role in the next maybe 18 months. Virtual care for our residents has got to play a higher role. When you think about taking a resident out of the home and the touch points that you have, whether it's just in your vehicle, and then getting to a doctor's office, in an elevator, the doors, all of those touch points. And now that we've got this virus around us, we're very sensitive on that. We didn't think about that before. I didn't think about that before. I mean, my wife's a nurse, so she's like, "Did you wash your hands?" Yeah, I did. Well, wash them again. Okay. She was always at me for that, but I didn't think about it as much as I think about it now. So when I look at our overall health, I think if we can reduce some of those touch points and reduce when we take a resident out of a home, that they're very happy here. They're very happy to stay here, and there's that anxiety of having to go out. If we can get rid of that, if we can change that and still have the same outcome. And so I think virtual health has to play a huge role. And I think if that happens, I think it's going to be really, really solid for healthcare.
Amy, would you like to follow up with that?
Yeah, I agree 100% with John. Think about how many rural communities in New Brunswick have benefited from the fact that physicians are permitted to do virtual visits. And the COVID-19 crisis ushered in that alone is a major change and a major benefit. But also, I have never before, I mean, John has more experience than me, but I have never before been part of committees that were interdepartmental, also including, the private sector or the operators on the front line like us. So meaning committee meetings with health, DSD, and frontline workers that were trying to solve solutions quickly and with the best possible outcome. I've never been on a committee like that until COVID-19. There were several opportunities to participate, and I actually felt very emotional about it. I was shocked a couple of times sharing my perspective. I kind of, had a lump in my throat because it was the first time I had seen people want to pay attention to other departments, like sincerely wanting to benefit from that collaboration. And I hope that continues.
Yeah, I do too. So Jarvis, just to take another point at this, we estimate that 47,000 New Brunswickers do not have access to primary health care. So 47,000 New Brunswickers don't have a family doctor.
Wow.
So, so where do those people go? Well, they have to go to an after-hours clinic, or they go to outpatients. They go to the emergency room. And so, when people need to go to emergency room, it has people that are clogging up the system. So virtual health, it's inevitable that it's coming. It's just how quickly can it come and what cost will come with it. But when you think about 47,000 people that don't have a doctor, well, let's say the average doctor has 1,000 people in their practice. We need 47 new doctors. What's the cost of that? And people need healthcare. So it's going to really help, I think, our long-term care, market segment. But it's going to help New Brunswick overall. It's going to help all society. And Amy talked about a rural environment. So I know Sussex is looking at you know, how do we play a larger role in healthcare in New Brunswick? You know, Moncton has the 2 hospitals, and what if we lose a hospital? And I know people in Sussex are going, how do we step up? And you know, maybe there's a call center, maybe there's a virtual care center that would be based in Sussex. You know, I think there's a lot of talk that's going on, and I think things are really moving rapidly in the right direction. And like Amy says, you know, departments aren't just staying in their silo. They're reaching out to other departments, and they're listening, and they're collaborating, and they're trying to come up with solid solutions. And this is unprecedented. We haven't done this that I know of, and it's really refreshing. It's encouraging.
Thank you, John. Thank you, Amy. Amy, after this pandemic, many of us will be tired mentally. What are some ways to recharge after the pandemic, not only for yourselves as leaders, but for seniors too?
Yeah, this is an opportunity for us, I believe, to stand back and reflect and take seriously, you know, some of the concepts of burnout. For example, that's an easy word to use, or loneliness. So loneliness has been proven to affect our health and well-being. Physically, there are physical consequences and mental consequences to loneliness. And there's a great deal of research available. Again, COVID-19 catapulted that area of research forward. And as we think about entering what New Brunswick calls the green phase and kind of reopening the community to regular activity, I think you have to also acknowledge that we have experienced a negative event. There has been a trauma, if you want to call it that, but there's definitely been a negative event, which can perpetuate negative thoughts and feelings like anxiety and worry. And the problem of getting stuck in that loop is that anxiety and worry influences our behavior, you know, whatever coping strategies we have to deal with our worries. And then again, that leads us back to negative thoughts and more anxiety and more worry and more bad strategies. So we actually could potentially, many of us get kind of stuck in a loop right now, unless we take a moment to consider how to get out of that cycle. Simply, you could plan a vacation in a way. So if you think about when you're stuck in a negative cycle at work, you take a vacation to rejuvenate. Let's take a vacation from the cabin fever we now have as a result of the pandemic. Plan something that is special, simple, safe, but it's an opportunity to do something that's different than what we've been doing the last year and a half. And maybe jolt ourselves out of our current routine. For example, this week I simply picked up the phone of a friend who's planning a birthday party for her daughter, and I said, can I invite myself over to the girl's birthday and just sit on the step and talk? And she said yes. And I thought, and the girls of course objected. They gave us rules, you know, of how we're not to intrude on the birthday party. And I thought, oh my goodness, I haven't had this normal kind of feeling in a very long time. And I need to think about what are those normal things that I forgot I used to do. And I need to start doing them. So to take it kind of a next level, you might want to also break yourself down into categories. You know, we have mental, physical, emotional, and spiritual aspects of who we are. And you can actually break those down into goals. Set a goal in each of those categories and map it out from now until Christmas, how you're going to achieve that. So one way, I'm just going to share, one way I do this is visually with what they call a vision board.
Okay.
Yeah, it's a vision board. So after I decide what I want to, set my mind on for the year, I make a visual representation of it. Now, let's be honest, the date on this one is 2019, and I'm going to forgive myself for not making one for 2020 or 2021. We have to be gentle to ourselves, right? That is a really true example of not being focused on my whole person for almost a year and a half. So it's a chance maybe to set something from now until Christmas. Make it visual. You can leave yourself notes, right, on Post-its. You can leave yourself a note on a napkin. Just choose something that you're going to do, or several things that you want to achieve between now and Christmas. Very, very, keep it simple, but make it visual somehow. The other thing for leaders to keep in mind, whether you have employees or a parish like what you have, Jarvis, reaching out and understanding the perspective of the people around you is important. So for me, calling my friend and sitting on her front step is what I need. But it could be very different for somebody else. So as a role of the leader, you have to reach out and try to come to that understanding of what the people around you need to get out of this rut of COVID-19. And then I think churches and businesses have the opportunity to support those needs that are identified. And that'll be very different depending what group of people you're serving.
And speaking, not only recharging leaders, but recharging seniors too. I know as a family, we have a responsibility. I took my kids into the senior care home, not inside, but on the outside in the winter months. And we built a big snowman, actually multiple snowmen, for their great grandmother to see. And that brought a smile and a laugh. And I hope that as families, we can do stuff that not only as leaders, but as family too. And I think there are so many creative opportunities out there. John, can you speak to that about recharging seniors and what that can look like?
Yeah, I just want to say, Amy, you made some excellent points. I agree with you very much on all of that. As we move green, we haven't been green for so long, we kind of forget, and we haven't prioritized ourselves. I know just in, because we're long-term care owners, home owners, it's always been about our staff and our residents and our families. And we're fielding, so many calls. Lynn talks about last Canada Day, July 1st. We were off, but nothing stops here. She had 22 phone calls that day. And there's just so much that happens that when we go green, it's going to be it's almost unreal, because we've been in this so long, we've been immersed in this for so long. It's going to be, it's really good. I'm almost speechless, Jarvis, when we get out of this. You're gonna be looking over your shoulder going, well, when are we going back in? How long are we out? So I think for me, I don't think I'll realize how busy I've been until I have that stress relief, and then I'm not sure what happens. To be frank, I think I'm hoping that I do one thing a day for myself. Whether it's read a verse, whether it's go for a walk, whether it's to meditate, just to find where I'm thankful. Those are some of the things that I'm hoping to do. But one of the things that I want to do, and I want to make it a priority going forward, is to spend more time. Our office is in the basement, and it's busy, and that's just the way it is. But I need to prioritize spending more time with the residents, and that's just a smile, with a mask off, because when your mask is on, it's not fair. that's how I feel. You know, it's not the service that we want to provide. It's not the love we want to give. You know, like our staff, you know, they want to hug them, they want to kiss them on the cheek, they want to, you know, they want to do that. That's why, you know, that they're not doing this because they're paid a lot of money, because they're not. They're underpaid. You know, and we're fighting that, and we're going to make big strides on that. There's going to be a lot that's announced about long-term care pay. But they want that, they crave that connection with the residents. And I'm really hoping when we go green that that's going to be the fruit of our labors, and it's going to be good. But that's my goal.
That's an excellent goal. John, someone said that just because you've made progress doesn't mean you've reached your potential. What goals do you have in place to reach your full potential?
We had an opportunity 3 months ago. A home was closing in Moncton, and residents were going to be put out on the street, and they were given August 31st as their deadline. And if the home didn't sell, they were closing, and so we looked at it, and you know, the whole family looked, and it was, you know, with Lynn and Sarah and Ben, it was, you know, what's our role here? You know, what are we supposed to do? And I mean, this is a life-changing, you know, opportunity, and you know, we threw our hat in the ring, but at the end, we didn't pursue it with everything we had because it wasn't the right opportunity for us at the time. And sometimes you have to realize that your potential isn't about how much you can do. It's about the balance that you have, and at what risk and what cost do you have. You know, what is the verse? You know, what it is if you gain the whole world, but you lose yourself in the meantime. And so, you know, there's things that I'm not doing personally that I would like to do. You know, business-wise, you know, we're hitting all the marks. We're doing very well, and it's a lot of work. But I really want to have a vacation. You know, we've never taken, anytime we've taken a vacation, we've left town and gone somewhere for a week or more. We've never had a week off and just stayed home. We've never done it. And Lynn and I have been married 32 years. Never done that. I want to take a vacation, and I want to, you know, I don't think it's a midlife crisis, but it's time to reevaluate. You know, where are we going, and how are we going to get there, and who needs to be on our team, and it's good. It's good to kind of do a personal inventory, and then just see where that takes you. But I just can't wait to get green. I really can't. It's been a long time.
And thankfully that green, we can see that finish line around the corner. Amy, this pandemic has forced us to be innovative. How can you help your staff to be innovative as you journey forward?
Yeah, the biggest trial I think we've faced this last year and a half has been to recruit, retain, and train our staff. So we can meet all of the infection control protocols, all of that stuff, because we're healthcare professionals. That's what we do. But what became very difficult was when honestly 20% of our employees were affected somehow by COVID-19 and had to be absent from work all at once. Back in the spring of 2020. And that just, I don't know, it was completely, I'm with John, I need a vacation. And on account of that crisis alone in staffing, we never once ran short-staffed, but I can tell you behind the scenes, it was because the nurses and myself did an awful lot of creative thinking, and if you want to say innovating around staffing. And I don't think that's going to go away, actually, because new ideas emerged about where to find very good caregivers, how to standardize their training and how to schedule people so that it works for mostly women who have families at home, and schools were impacted also this year. So it's kind of exciting, actually, the opportunity we have to do staffing differently and innovate around human resources.
John, would you like to respond to that?
Yeah, just, Amy talks about, when staff have to do something, whether they're, it used to be that they need a weekend off because there's a wedding. Now but you kind of plan for that. You kind of saw that coming. This is, my son just came home and there's an outbreak here, and, I can't, I have to get tested, and so, but you call to get tested on a Monday, you're going to get your test on a Tuesday, you're going to find out on a Thursday. And, so there's 4 days for just one staff. So that has really been a difficult thing for us to go through, that we weren't trained for that, and staff weren't expecting that. And they look at, they have a standard paycheck that comes in every 2 weeks, and they didn't expect to miss 4 shifts. So they're coming to us going, how can you help me? How do I catch up? Where can I fill in? And so that's been something that we've just not had to deal with before. Yeah.
John, what are some ways the church can partner with senior care homes?
Well, the impact, those Christmas boxes you did last year for us, the impact that had was it was shocking, really. I didn't see that coming. I knew that they would enjoy it. Who wouldn't? That just makes common sense. But it was well beyond that. It was profound, and I'm seeing the interaction with the youth. I don't know if it's because we wear masks that maybe there's a deficiency of that interaction, that when they see the youth, it magnifies the impact of it. And I'm not sure, but those kinds of things, were very impactful. The YouTube moments for the short services that we were able to connect, that the church did, and, it's a shorter service, and we played that on the TV, and it connected our seniors to our church, and that was very, very good and much appreciated. So I think we're hitting most of those things, and the consistency is good, and I'd like to see those things continue. I think that they've made an impact, and you know what, life is short. We had last night I had a Zoom call with about 80 people. One of our football captains passed away this spring in PEI, and he was just an amazing individual. And our team, we started in the beginning. My first game at Mount A, we lost 70-7, and we didn't win a game that year. And that was my first year. And we went to the national championship at the end. So we went literally from nothing to a championship team in 4 years. And this guy was part of that. And the 80 people that were on the call, we're all part and parcel. Somehow we're connected to that, whether they were fans or players or coaches. And it's, life is very short, and we think we've got a long time. And, what impact do you make on other people? And it was nice to see last night the impact he made on all of the people that were on that call, and then many, many more, obviously. But and so I had just a chance to reflect about what's the impact we have on our seniors, on our staff, what's the impact the church is having on me, what I'm having on the church, and it just give me an opportunity to be more thankful for what we have. I know we can complain, we can bellyache a lot about what the situation that we're in, but boy, I'm really thankful for my church family and the support that we have. And I just like to thank everyone who's watching, and I wish you all a good green zone.
With respect to life being short, I heard this funny quote once. It said, "Life is like a roll of toilet paper. The closer it gets to the end, the faster it goes." But we want to seize the day, as
Yeah,
we
we sure
often
do.
hear. Well, thank you. Amy, if the current crisis is a disruption, how will your senior care home be prepared to be further disrupted?
Well, disruptions are not predictable, but my guess is the next disruption is going to come in the form of two words: the baby boomers. And I don't think we're quite ready for the type of long-term care the baby boomers are going to ask for. But that's my prediction what the next disruption will be. And to prepare for that, I think it would be important to start talking with people in that age group about what financial and what healthcare needs they anticipate having and how they want our government policies, programs, and also our private enterprises to address them. I actually don't know the answer to, but I know they like choice and control.
Mm-hmm.
So I think we're going to have to modify the application of our current programs.
In what way?
Our current programs generally are very prescriptive and direct the client through them. That's not choice and control. Choice and control will offer the baby boomer, flexibility in when and how often they access services and from where. So it's going to be exciting, actually, to see what entrepreneurs like John and myself can do to meet the disruption that is the baby boomers, to meet their needs, and hopefully government will adapt quickly, because it's coming.
John, would you like to respond to that?
Yeah, my son Ben is very tech savvy. I don't happen to share that. I think we just kind of missed that, and baby boomers have missed that that generation. That generation's kind of missed the technological revolution that happened. But we're catching up. We're still able to do our wireless headphones. We're still able to somehow connect them.
I got my wires.
Well, we're more challenged. I remember my mom and dad. Johnny, the power went out. Can you come over and reset the VCR? It's flashing, 12 o'clock. Can you come over and put the time on that? Because your father can't seem to figure that out. And I remember thinking, well, wow, I'll never be like that. I'll always be able to do, technology. And now I watch Ben, kind of take care of me on some of those things. And one of the disruptor things that's happening that it's a new thing is seatless restaurants. So it's just a kitchen. So it's a commercial kitchen, and they make food, and it's always delivery. So everything is delivery. All they do is they have a world-class kitchen, and they can make everything. And so this is almost in a warehouse. It could be an abandoned warehouse, and there'll be different companies that would set up and that all they do there is cook and get it out, whether it's skip the dishes or whatever, get it delivered to you. And that's a tremendous disruption that in the restaurant business. So what's going to happen in long-term care? And I think Amy's saying that, we got to get ready for residents and say, I don't want beef and gravy and potatoes and squash today. I feel like a hamburger today. And we got to get ready for, is it that choice and control that they want, or what else do they want? And so that's going to be quite a challenge. And is it going to be, with choice of, I don't know. I don't know. There's just so much that's going to happen in long-term care You know, we need better training, we need better pay, we need better. There's a lot of things that we need that we're working on, and where this is going is exciting, and I know that Amy and I are certainly going to be part of it.
I remember one of Billy Graham's team members was interviewed on 100 Huntley Street, George Beverly Shea, who is Canadian from Ontario, and he was playing on YouTube, watching the videos at 104. And George Beverly Shea at 104 looks into the camera and says, "If I can do this at 104, you can too."
Absolutely.
I'll never forget that. John, what lessons do you want to carry into the future after the pandemic that will make an impact on senior care homes?
I think before the pandemic, you know, we had people come in the home that would play the guitar and sing, and we had activities, and we'd play bingos, and it was great, and those things are still going to continue. They're very, very important. But I think the profound change that I've seen is youth with our seniors, and we need to do a better job of reaching out and asking, and that's one of my, I don't do well at asking for help. I don't. If I don't have it, I'll go without. If you had to say, well, what would one thing be that you'd like to change about yourself? It'd be that would be me. I just don't. I won't. It's an issue, and I need to fix that. But I'd like to figure a way to incorporate youth in our home more than we have today, and I think that's very, very good therapy for everyone involved.
Good word, John. How about you, Amy?
Yeah, I agree with John. You know, coordinating community involvement in our facilities. Definitely, I would like to learn more about how to do that sustainably. But for me, the biggest lesson, and I think a point of pride, is that New Brunswick has an outstanding long-term care system and outstanding community care services like extramural in their programming. And we have to stop looking elsewhere for solutions. We're doing a very good job. We have good standards. We need to toot our own horn, promote our own ideas a little bit better, and stop wasting time, get down to business, and get ready for the baby boomers.
And one day I'll be there too. Hopefully you won't have to kick me out.
We have a room for you, Jarvis.
What's that room?
Well, I should say we have a closet for you. No.
Okay, all right. I'll try and not be too rowdy.
Yeah.
And you know what, Jarvis? I just want to say, like, my point of pride in New Brunswick's long-term care system is simply that, for the most part, simple and grassroots is what's going to work for New Brunswick. And that reminds me of the other lesson we should carry forward from COVID-19, which is simple and grassroots. And John mentioned it earlier, that warm, soapy water and good coughing etiquette has always been a very good key to success in staying healthy.
Good lessons. Well, thank you, John and Amy, for using your faith to impact the senior care homes. And thank you for painting a picture of the next chapter after this pandemic.
Thanks, Jarvis. It's good to be here.